Hello, everybody. Thank you for the introduction. So today I'm going to present a new pipeline that we developed for the analysis of infant brains. And I'm going to be manning the poster this afternoon, so if you have questions or you're interested in further details, please come see me there. So the goal of writing this new pipeline was to have a set of tools that allows us to do full brain segmentation and surface extraction with results or outcoming files that are compatible with FreeSurfer in order to enable a seamless and consistent longitudinal analysis in the future. The age range of our interest is the 0 to 2 year of age range. And currently, we wanted to accommodate T1-weighted clinical scans, which is predominantly available for our clinical collaborators. Prior work, similar to ours, has been focusing on introducing atlases. These atlases were either manually outlined, semi-manually outlined, or projected from the adult space. And segmentation tools that are oftentimes age-specific, specific to, let's say, neonates, 1-year-olds, 2-year-olds, or they have modality restrictions. Let's say they are applicable to T2-weighted images. They require both T1 and T2-weighted images, or sometimes even diffusion-derived scalar volumes. The main building blocks of our tool are the following. So there's an important skull stripping step, as a pre-processing step, the segmentation step, and surface extraction, as well as a training data set. Our training data set is a manually annotated data set, and the segmentation guidelines are outlined in our 2015 paper. And the graph below at the bottom of the slide shows you the age distribution. As I mentioned, our age range of interest is 0 to 2 years of age, so we try to have manually data sets almost uniformly sampling that age range. So let me talk first about the skull stripping algorithm. This is a double consensus framework, and what it means is the first step, or the first consensus, establishes solutions from multi-atlas skull stripping methods. And the second consensus fuses the carefully optimized and selected masks into the final solution. Currently, it uses multiple pediatric atlases and multiple skull strippers. And I want to emphasize that the framework selects parameters that are optimized for the particular subject and not for a particular data set or for the infants in a particular age range. Just to show you images of what inspired us to set up this particular framework. So in case of adults, we know that we have very robust and highly accurate skull strippers that work very nicely. However, if we apply these tools directly to the infants with the default parameters, oftentimes the outcome is not desirable. We can tweak and optimize the parameters on an individual basis to get better results. But what we realized is that there are still errors, and the different tools make different errors. So if we could come up with a consensus, or we could focus on the areas that all of these tools got accurately, maybe we can eliminate the errors that they are making individually. So that's the consensus image. That's the outcome on this slide. So this inspired our framework, and we wanted to automate this process. So in a joint work with Yang-Ming Wu, we came up with a framework that by now has been tested on multi-vendor and multi-site T1-weighted MR images of infants. And I'm showing you 4 different examples for 4 different ages: 3 weeks, 18 months old, 22-month-old, and 46-month-old subject, where we are comparing our outline, or the red boundary, with BSE BAT and manual segmentation results. So that was the first component. The second component is segmentation. Our segmentation tool is also a prior-based or an atlas-based method. It uses the training data set of 26 subjects I have already introduced. And it's a modification to a multi-atlas label fusion algorithm that has been described by Iglesias in 2012. The 2 key modifications to that method are the following. So our current tool allows for missing labels, potentially missing labels in your training data set. And it also does not assume a particular image intensity distribution in your images. And that's key for the infant population, because there's the myelination process causes a contrast change. So you can't really assume a particular image image intensity distribution at a particular label. So that allows us to use a large training data set and to be able to outline as large number of set of labels as we have described in this data set. And the third main building block is surface extraction. We have white matter surfaces reconstructed that closely match the image segmentation outcomes. The PL surfaces are also initialized, or they are initialized from the white matter surfaces. However, they are less dependent on the intensity information compared to the adult analysis, given that the cortical ribbon at this age is very heterogeneous. And then, just like in case of adults, topology correction is a very important step at this stage of the algorithm. I'm showing you some quantitative scores of how well we do in case of our manually segmented data set. These are for cortical labels and then subcortical labels. The color code here means neighborhood size. As I mentioned, we have 26 manually segmented labels. So with the blue colors, we are using a small set of this full training data set, and yellow indicates that we are using the full data set. At this point, the recommended number of training data sets is around 4 in order to optimize for accuracy and optimal performance with respect to computation. I'm going to show you some images to indicate what kind of outcomes we get with this pipeline. This is an age-sorted selection of our manually labeled data set that is affinely aligned in an unbiased coordinate space. So these are the input images, these are the skull strip versions, these are the segmented versions, color-coded by the FreeSurfer color table. These are parcellated and segmented, so there's both cortical and subcortical segmentation labels. And these are the parcellation labels that have been projected to the PL surface. We are already working on additional features in order to be able to add to our current pipeline. We would definitely like to accommodate T2-weighted images, either an auxiliary or a primary input image. We would like to adapt parcellation labels that have just been introduced by the MCRIB lab and augment a newborn-specific pipeline with 10 currently available new data sets as a training data set. Besides using age as finding the closest possible neighbors in order to help you identify neighbors in our training data set, we are implementing an image feature-based selection of your neighborhood size. And also, we would like to keep validating the cortical annotation measurements further. We would also like to do a direct comparison with different tools and atlases that are available. However, it's a very challenging task. The challenges arise given that the input dataset requirements are very different among the currently existing tools. The tools have been validated or introduced for very different age ranges. And also, oftentimes, the anatomical definition of the labels that are produced or outlined by these tools are different. Even with all these challenges, we have tested tools Mantis, iBeat, and DrawEM, and I'm going to show you results for the last one. Given that this was the tool that was applied to a data set that was just recently released by the Developing Connectome project, in this data release, 40 representative term neonatal subjects and its images have been released with a resolution of 0.5 isotropic MR images. And the segmentation pipeline included BET for skull stripping and DrawEM on the T2-weighted images. These are the segmentation labels that were released. So this is the 9-label segmentation where there's no distinctions between left and right hemisphere labels, and the 87-label segmentation. As I mentioned, our tool works on the T1-weighted images, so we didn't work from the T2-weighted images, but on the corresponding T2-weighted images. This is how the set of input images look like. Again, these data sets are finely aligned here just for representational purposes in this unbiased spatial coordinate space. This is our skull stripping segmentation result, parcellation result. And these are preliminary dye scores or overlap scores between on the left-hand side, the 9-label segmentation and the higher number segmentation, you can see that it is only a subset of the labels that have been involved in the comparison here. This is because of the different definitions of the anatomical labels in the two data sets. I would like to acknowledge my collaborators who are at MGH, the Boston Children's Hospital, and UCL, and my funding sources. And again, if you have more questions, please ask them around or come see me at the poster. Thank you very much.
Thank you so much. We have time for one question.
Yes, thank you for a very nice talk. I think that's a very needed pipeline. I was a little bit surprised that the maximum accuracy was obtained with only using 4 subjects. I mean, is that because they're very heterogeneous, or?
Wait, so say it again, which results?
That the maximum accuracy was obtained using a training set of only 4 subjects.
No, we did that for all 26 subjects. So every time one of the subjects was tested, only maximum 25 data sets were used. So obviously we didn't use the subject itself in the training data set.
Okay, maybe I misunderstood you.
I think maybe the bars that you are referring to are the cortical labels and then the subcortical labels. They were separated out just in order to show the subcortical and cortical differences.
Never mind, thank you.
Okay.
Thanks very much.